Assalamualaikum and good morning to our lecturer, Dr. Muhammad Sahiza Musa, and my fellow friends. Today, we want to talk about one of the international non-profit organization, which is Malaysian Medical Relief Society, or as known as Mercy Malaysia. So, what is actually Mercy Malaysia? Let's see together. Mercy Malaysia is an international non-profit organization that focuses on delivering medical assistance, long-term health-related development, and risk reduction activities to vulnerable populations in both crisis and non-crisis situations. As a non-profit organization, they rely completely on funding and donations from organizations and generous individuals to continue providing humanitarian aid to beneficiaries in Malaysia as well as internationally. It all started with the war in Kosovo, which began in 1999, that has cost thousands of lives as well as caused immense hardship. A Malaysian obstetrician and gynecologist, Dr. Jamilah Mahmud, was compelled to give her medical services after witnessing numerous innocent civilians, especially women and children. As there was no national organization that was prepared to respond to such an international crisis, she founded Mercy Malaysia with a group of like-minded friends. The vision of Mercy Malaysia is to be outstanding in delivery of medical and humanitarian aid to all, while the mission of Mercy Malaysia is an international non-profit organization that focuses on providing medical relief, sustainable health-related development, and risk reduction activities for vulnerable communities in both crisis and non-crisis situations. In fact, there are many programs that Mercy Malaysia made, such COVID-19 Pandemic Fund, and many more.
We know that the first time COVID-19 hits Malaysia, the government stopped people from moving around the whole country. Almost all the country followed this rule. This means that large groups of people can't move or get together anywhere in the country for religious, athletic, social, or cultural reasons. Because of that, it is impossible to carry out NGOs activities or programs as well as any task that requires the participation of volunteers. With the help of Malaysian National COVID-19 Immunization Program, the rate low of new cases have been going down. Although the program progressed smoothly, it was plagued by several debates and concerns, such as some people live in Asia, therefore they don't know such thing, and the danger about the COVID-19. Since the pandemic crisis is still going on, we owe a debt of gratitude to the non-governmental organization teams, which is more eager than ever to help those who need it. Mercy Malaysia is one of those non-government organizations or NGOs that are helping with volunteer works here. Mercy Malaysia is an international non-profit organization that helps vulnerable people in both crisis and non-crisis situations by giving them medical aids, working to improve their health in a sustainable way, and doing things to reduce risk. Mercy Malaysia is based in Malaysia, and its goal to help those who are most likely to suffer. Mercy is trying to make the problem less serious by starting a vaccination program that goes house to house. Syed Al-Huzairi Ibrahim, the General Manager of Operation for Mercy Malaysia, said that 20 volunteers from Mercy Malaysia will take part in the first phase of the program. These volunteers will be split into 3 groups and sent to Selangor and Kuala Lumpur to help with the Minister of Health vaccine outreach programs. Health Ministry and Welfare Ministry also help Mercy by giving the groups the name and address of the people who will get the vaccines. There were as many as 11 homes with a total of 36 people in the areas of Verona and SYAZWANI that were chosen for vaccination on Tuesday. To get to the house, the van carrying the vaccine and the staff has to drive on narrow roads through the area with a lot of trees and bushes. and also spotty internet connections. Serinang Subidisi he made it hard for her to work for the past 4 years. So she was glad that the welfare department told her that she and her family wouldn't have to go anywhere to get their shots.
Assalamualaikum warahmatullahi wabarakatuh. My name is SYAZWANI binti HARNIZAT and my student ID is 20082086. Today I will present to you about activities of Mercy Malaysia. To begin with, in order to provide assistance to the Ministry of Health Malaysia, Mercy Malaysia ran a program called the Vaccination Outreach Program. One of the efforts that have been made in the vaccination outreach program is that they have begun giving vaccination to patients who are homeless and have difficulty attending any vaccination center. This is due to the fact that the government has set the level of success for achieving vaccination at a maximum of 80% of group immunity. For instance, Dr. Zaini Hussein predicts that anywhere from 250 to 600 people will be vaccinated every single day. Not only has the program been carried out in open housing areas, but it has also been carried out in rural areas, in Aboriginal village, in PPR people's housing, and homeless people. Next, Mercy Malaysia has made a donation in the form of equipment and facilities. Laptops, fans, injection trolleys, wheelchairs, and banquet tables were some of the things that were given as donations. The contribution has the potential to also assist in increasing PPV's capacity. Furthermore, Mercy Malaysia works to educate Malaysians on the importance of the national COVID-19 immunization program. There are a total of 7,000 volunteers, and these volunteers can be divided into two categories: those who have a background in health and medicine and those who do not have a background in health and medicine. Both are important in the effort to raise public awareness at various levels, including in Sabah and Sarawak. This is due to the fact that he claims that it is not always necessary to have medical professional present, because sometimes the language that needs to be used to convey information to marginalized community is a language that is easier to understand.
Assalamualaikum warahmatullahi wabarakatuh. My name is FADZLUN SHAKIRAH binti ISMAIL. Today I am going to be presenting about the Mercy SWOT analysis. Mercy's main strength as a non-profit organization is specifically their status in the law. Mercy is a well-standing organization that is legally registered under the society in Malaysia according to the Societies Act 1966. Headquarters of Mercy is located in Kuala Lumpur. This is the strength that can solidly defeat other non-profit organizations because Mercy is legally registered under the law. Mercy Malaysia's vision is to be the best in the world at providing medical humanitarian relief to everyone. Mercy Malaysia is also an international non-profit organization whose aim is to provide medical aid, long-term health-related development and risk reduction programs for vulnerable populations in both crisis and non-crisis situations. The vision that this organization holds as a pillar to ensure that their service to the society is well served and completely benefits the country is indeed a very strong vision. Moving on to the weakness of Mercy. As a non-profit organization, they gain nothing from their hard work and service that they have done for the people and government. They are fully supported by the funding and donation organization and generous individuals that are willing to support them in progressing their activities and programs. In order to continue serving humanitarian aid to beneficiaries in Malaysia as well as internationally, this means that the amount that they receive from the funding determines how well and how many programs they could do. The less they earn, the program would be lessened, and the other way if they receive higher funding. The opportunities that Mercy has is opportunities foreign donor agencies and other sector groups provided assistance. Mercy Malaysia, for example, got a great donation from Qatar charity for Mercy's flood response shelter repair kits during flood in Kuala Krai, Kelantan. These opportunities may be the proof that Mercy is a well-trusted NGO since they are already receiving help from international sources. This is why it is important for an agency to be legally certified to build high trust in their donors. threats for Mercy are other NGOs. This is because NGOs may provide more type of service than Mercy. As we all know, Mercy only provide health-related service, contradict with other NGOs that provide more type of service like providing foods, clothes, cleaning service, and provide more necessities for the people during crisis time. Moreover, medical equipment supplies are very expensive, and Mercy could suffer from shortage of supplies for the people during crisis time. Dealing with security issues such as war, access to target groups and areas to channel support in an affected country is limited. This means that when a nation crisis occurs and Mercy has to perform their responsibility as an NGO, the help that offered will be unreachable to certain areas because of securities or other problems like natural disaster. That is all from me. Thank you.
There are several recommendations for improving Mercy Malaysia's programs so that the organisation becomes more efficient and capable of reaching its goals. The first is to promote the role of Mercy Malaysia through social media. Social media is an online communication network that allows people from all over the world to communicate with each other. Mercy Malaysia can use any social media platform to spread information about its organisation, such as Facebook, Twitter, Instagram, or TikTok. Not only that, but social media can also be used to encourage people to get the vaccine to prevent the COVID-19 pandemic. This can help to increase community awareness about the importance of vaccinations. Then, attract more volunteers to work with them. This is also to attract the general people to join hands in channeling funds and assistance through a large-scale campaigns. For example, Mercy Malaysia needs to get other non-governmental organizations to collaborate with it in order to form a partnership and carry out joint activities. In this scenario, they can also learn from other NGOs about how they manage and handle the program. If they partner with other NGOs to help the public, they can easily and rapidly achieve their goals. Finally, making donation fund. Mercy Malaysia can collect donation from the general public. The donation collection can also be done through public such as mosques, schools, private agency or government, as well as public places such as supermarkets. However, during the movement control order period, donation can also be made through Mercy Malaysia's online banking account. The bank account information for which can be accessed on their official website. As a result, collecting donation can help some parties in reducing the spread of the COVID-19 outbreak, as equipment such as masks, hand sanitizer, and gloves are sufficient to be supplied to those in need.
In conclusion, Mercy Malaysia provides many benefits to Malaysians. This can be seen in the program that they have run in order to help the Ministry of Health to achieve herd immunities, which is to vaccinate from house to the homeless in rural areas and patients who have difficulty attending any vaccination center. Not only that, Mercy Malaysia has also helped to raise public awareness of the importance of preventing the COVID-19 disease from spreading, and also to help raise the awareness of Malaysians about the importance of the COVID-19 immunization program that is being conducted nationally using any social media platforms to spread the information. Aside from that, they also can promote themselves through social media, as it is one of the famous platforms to attract skilled and interested individuals in the field of non-governmental organizations and invite them to join the program that they have made, and also attract more volunteers to work with them as well. In addition, as part of the vaccination outreach program, Mercy Malaysia has made a donation in the form of equipment and facilities, which is another effort the organisation have made, as they collect such donation or contribution from all governmental organizations, NGOs or the general public. As a result, once the item and equipment are added, Mercy Malaysia will be able to provide it more readily and promptly without getting into issues like a lack of equipment.